So as an event manager, I think one of the things that's really difficult is the idea of trying to navigate a variety of people that are in a room and the information that's coming through to you. And the whole idea of trying to take a broad view is something that is really challenging. It's something that I've always found myself I've really had to focus in on and trying to keep a general view of what's going on in front of me.
Yeah, I agree with you. I think it's one of the hardest things to do as an event manager. It's very easy to get caught up in an algorithm. You know, we're going to follow the PALS algorithm. I'm going to focus on the fact that the patient is having PEA, for instance, and I'm just going to keep treating in the same way. When what I really need to do is be able to step back and look at the whole picture, think about the patient's history, how this event started, what all the different pieces of physiologic monitoring are telling me, and fit that together to come up with sort of a differential diagnosis and not just think about following an algorithm.
Right.
And it's hard to do that when you're multitasking, which we're often doing.
And we have such talented people that we work with, and we ask them, I think that's it when we talk about role clarity and people are doing a specific portion of that resuscitation or navigating an emergency. I think that it really, there's so much to be said for stepping away and not being right there at the bedside, but being able to take in all that information and then think again about what the whole picture is, because there's a lot of data that goes into making an assessment and having all of the information and checking back with all of these providers is really an important aspect, because we've all seen the difficulty when people become fixated on a particular aspect of a problem and then losing sight of what the overall problem might be.
Yeah, and I agree. And in addition to that, when as an ICU provider, I always want to be hands-on, right? I kind of went into ICU because I like procedures and I like being hands-on, but I have to really overcome those tendencies when I'm an event manager and realize that I need to delegate those tasks like managing the airway or like getting access to another skilled provider so that I can maintain my situational awareness. Because if I get focused on the airway, I'm going to forget about all the other things that are going on around me and I'm going to miss important clues. I'm curious, what are some of the things that you have used as strategies yourself to try to maintain your situational awareness or maintain that global perspective?
It sounds silly. So I've found like a physical, I remind myself that I need to do, so I put my hands behind my back oftentimes, and I really try and position myself at the head of the bed, but again, about a step back, so that I can see everything that's going on around me. And I think it's really important to check in with the various skilled providers that do have specific roles, and reach out to them, so because they're often fixated on a particular aspect of their care. So that's been something that I've used. I mean, how about you? What have your strategies been?
One of the things that I've found really helpful is kind of recapping for the whole room where we are with the event. So giving a clinical summary of, this is a 12-year-old boy with myocarditis who's just had a PEA arrest. Here's the things that I'm thinking of that are going on. Is there anything that I'm missing?
Right.
And I find that forcing myself to actually articulate that summary of the patient helps me recognize what gaps I might be missing, and then also gives the opportunity for other providers to fill in things that they know, pieces of information they hold that I don't have, that are not within my global perspective for that reason. So I try to do those recaps frequently, and I think that helps me a lot.
Oh, no, it's a great point. So, I mean, the other thing that recapping really does is, for me, it kind of resets what I'm thinking about, but then also the idea of what might change, what contingencies do we need to build into the emergency, because as taking that global assessment, you really need to be thinking a few steps ahead of time. And the idea of, if this happens, then we might go down this pathway, or we might need to use this medication if this happens. And again, it's that education of the providers that really helps them do their job better, because they're looking for outcome A, B, or C, and then know what we're going to be doing. So that's, I think, another aspect that allows me to think about the problem a little bit better, and provide a little bit of an understanding for the whole team about where we might be headed.
Yeah, I think it allows the team to anticipate resources and supplies that they might need. I think the good example of this is when we think we might need ECMO.
Sure.
You know, if we can actually say we're going to do, 3 rounds of CPR, and if we don't have return of circulation, we're going to go ahead and cannulate, it allows everybody to start preparing for that event. Yeah, so I think that's a great point.